Patel, can you really share how anemia can be managed in myelofibrosis with different procedures or drugs?
Yeah, absolutely. So anemia or a low hemoglobin is one of the common low blood counts we see in myelofibrosis. There are a variety of different ways that can be employed to kind of address anemia. And then the major symptom that patients have when they have anemia is fatigue. So the thought is by making someone's anemia better, hopefully we're improving their fatigue as well. So the first and kind of the longest standing thing is blood transfusions. So patients with anemia can receive packed red blood cell transfusions. This can be given at a frequency of any time from once every several months to sometimes as frequently as once every couple weeks or once a week. And blood transfusions are effective at raising the hemoglobin, but they are not a long-term fix. Oftentimes, with several days to weeks, the hemoglobin drifts back down. The other thing is with repeated blood transfusions, and I'm talking, dozens and dozens of transfusions, there are complications that can arise. So patients can have increased levels of iron from lots of blood transfusions. Patients can develop antibodies against the blood cells that are being transfused. So sometimes it can be harder to find a matched unit of red blood cells. So, with that in mind, there is a concerted effort to look at and develop therapies that may improve blood counts and maybe reduce the need for transfusions. So, another medicine that's commonly been used in the past are what we call erythropoiesis-stimulating agents or ESAs. And basically, it is supplementing the hormone that tells the bone marrow to make more hemoglobin, make more red blood cells, what's called erythropoietin. So, giving someone an injection, depending on the formulation, it can be every week to every few weeks that injection is given. Sometimes the extra kind of kick to the bone marrow can help it overcome the myelofibrosis and kind of increase the hemoglobin. Some things we watch out for with ESAs is sometimes it can make someone's spleen larger or kind of can cause symptoms from that perspective. So we kind of monitor carefully for that. There's another drug that's been approved for use in myelodysplastic syndrome, which is another different chronic blood cancer with anemia. And that drug is called luspatercept. To be very open, this is not a drug that is approved for use in myelofibrosis. It's approved for myelodysplastic syndrome. That being said, there's some early data to suggest that it is safe to give luspatercept to patients with myelofibrosis, and it could potentially help someone's anemia and improve their anemia. So sometimes that medicine is used, recognizing that is not an approved option. When thinking about JAK inhibitors, the JAK inhibitor amongst the four approved ones that has the most data for its use in kind of patients with anemia is one called momelotinib. So momelotinib was specifically kind of developed and investigated in patients with anemia in the clinical trial that led to its approval, really focused on that population, finding that somewhere in the neighborhood of a quarter to a third of patients that were on momelotinib actually had improvement of their hemoglobin. So if you're thinking about which JAK inhibitor should someone be on if they have significant anemia as well, momelotinib may be the right option for them. So a few different ways to tackle anemia. I think it's important to note none of them are kind of permanent fixes, but all of them hopefully are kind of being employed with the intent of either reducing the amount of blood transfusions someone needs or potentially having periods of what we call transfusion independence, so going several weeks without needing blood transfusions.